Sometimes life gets crazy and it's just too easy to focus on all the negativity in the world. Welcome to the audio antidote to that. On this show, we highlight the amazing and positive work being done in the world to remind ourselves that there is hope out there for the future. And along the way, we'll pick up some new perspectives and ideas so we can all work together to make the world a little bit better. Because we know that when creativity and community come together, we can create good. This is Creating Good with Matt Barnes. Let's do it. Hey, everybody. Welcome to the podcast. This is Creating Good with Matt Barnes. I'm Matt Barnes, and I'm alone today. Tiff is out, so it's just me. I'm bantering with myself. It just feels sad. This is the podcast where we are all about just creating good in the world and highlighting people who are doing that. In fact, we have started a whole movement toward that. We've got live meetups every month. If you are in the Orange County area, you can go to creatinggood.co and find out more about those. You can go to creatinggood.co/pledge and take the Creating Good pledge, which is a very simple thing saying that you're going to use what you have, your resources, your connections to create good in the world. And you get a little digital badge you can put on your website to let everybody know that you are committed to creating good in the world, which feels like we need a little more now than maybe ever. So go ahead and go to creatinggood.co, find out everything that we're doing, that we're about, spread the word. And we're just excited to get the word out about people creating good in the world, because all day, every day, I feel like all we hear about is the negative stuff. So creatinggood.co. You can follow us online at creatinggood.co on Instagram as well. Today on the podcast, we have an amazing person who is doing so much to create good in the world. His name is Osei Boateng, and he is the founder and executive director of OKB Hope Foundation. They're a nonprofit dedicated to transforming the healthcare delivery in Africa, particularly in rural and low-income communities. And he has done just amazing, amazing work to solve a problem that he himself saw and reaching communities that are not being reached and not getting the needs that they have met. And in fact, so much so that CNN made him in 2023 a CNN hero. They gave him global recognition as a CNN hero, which I kind of am jealous about. I kind of want that. That'd be cool. No, I mean, it would be cool, but I'm not jealous. That's really cool for him. Anyway, great conversation with Osei, and I would love for you to hear all the amazing things that he has to say. I'm here with Osei Boateng, and man, thanks for being here.
Yeah, thank you so much, Matt, for having me today. I really appreciate it.
Oh, yeah, my pleasure. I can't wait to hear more about you and what you do, how you became a CNN hero. This is a title no one on the podcast has had yet, so we'll get to that. We always start off with a segment we call 3 random questions. I've got a list of about 100 really random questions, and then a randomizer chooses 3 of them. So, you ready?
Yeah, I'm ready.
Okay, here we go. What is your favorite book and why?
My favorite book is The Purpose-Driven Life.
Oh,
And
good.
it's so it talks about how we are here on this earth for a purpose, and we are here to live out our purpose, and everyone have a different purpose. So it's very important that everyone sort of do self-reflection, identify what they are passionate and what their purpose is, and live accordingly to that.
Yeah, that's great. All right, question 2. Is there a fandom that you belong to? Is there something you're a big fan of that people may not know about? Or maybe do?
Yeah, I mean, I'm a big fan of soccer.
Okay.
In Ghana, I grew up playing soccer. We actually call it football when you're in
Football, of
Ghana,
course,
but
yes.
when you're in the US, they call it soccer. So I'm a big fan of soccer, and my favorite team, national team, is Ghana. The Ghanaian national team. When you come to the club side, I support Chelsea.
Okay, all right.
Yeah.
Did you watch Ted Lasso, the TV show?
No, I didn't watch that.
Oh, it's fantastic. You should check it out. It's all soccer, but it's one of the few shows on TV that is actually like makes you feel good about the world a little bit.
I'll
And
definitely check it out.
yeah. The last one, have you ever been in a helicopter?
Yeah, I have been in a helicopter, and that was when I visited the Arcadia Park in May. So we got the opportunity to be in a helicopter to see the whole park. So yeah, I've been.
Oh, very cool. Awesome. I'm a helicopter pilot, and
Oh,
so
really?
yeah, so I always like to kind of see if people have done that before, because it's a fun thing to do, obviously. Okay. You did well.
You did well at the 3 random questions. You've passed the test. We will now go into the interview portion. Now, tell me about you. Tell me about your origin story. Where did you come from? How'd you get to where you are? And what are you working on?
Yeah, definitely. And once again, thank you so much for this opportunity. So my name is Osei Boateng. Grew up, I was born and raised in Ghana. I lived in Ghana for the most part of my life till the age of 19 years, before getting the opportunity to migrate with my family in 2014 to the United States. And that was about the same time that I also started my college degree. And so I grew up in a community where access to healthcare was a challenge. And so most of my community members would have to travel several miles to the nearest healthcare center. And if I talk about several miles, a minimum of 30 minutes walking distance to the healthcare center. And even if they get there, there wasn't any guarantee that they will get to see a healthcare provider. So they will make this a minimum of 30 minutes walk to this place and get there, and there would not be any healthcare provider available. And so they would have to walk back home debating whether they were going to live or die the following day because they didn't get any healthcare needs. They didn't get their healthcare needs met. And so most of my community members face this on a daily basis. And unfortunately, some of them lost their lives. And personally, I also did the same. I lost my grandmother and my auntie because of this situation, where we were able to get them to the healthcare center. But by the time we got a healthcare provider to attend to them, it was pretty late. And so we lost my grandmother and my auntie because of that. So through these lived experiences, I said to myself at that very young age that once I become of age, I would devote my life purpose in ensuring that no one else goes through that same thing that I went through. I wanted to devote my life to ensure that rural and underserved communities have access to healthcare in a very timely manner. And so when I got the opportunity to study in the US, my whole entire goal was that I was going to be a doctor and then go back home and go and serve my community members. And so my bachelor's degree was in human biology. So I was a pre-med student studying to become a doctor. And it wasn't until my junior year when I was sitting in this class, anatomy and physiology class at Cornell University, and the professor started talking about different cardiovascular diseases, like, oh, we have hypertension, we do have diabetes, and if you don't know about this, you will die of it because these diseases, they call it silent killers. It doesn't show any symptoms unless it is at the very late stage that is very difficult to cure. And so I quickly realized that, you know what, I grew up from a place where we have to walk several miles to even the healthcare center. How much more getting access to these medical equipment to even check whether someone is hypertensive or not. And so I realized that, you know what, if I'm going to stay here and say that I want to go to school, become a medical doctor, you know, the road to medical school is 4 years, and afterwards, depending on your residence, it's going to take me a long time. And so I realized that I needed to make a change, and I wanted to do that right now. And so it was a spring semester. So that very year, I started looking out for, like, you know what, mini grants in the school to really apply for that, get some resources and go and do health education and health screening in these communities. And so that is how I started. I started off like, you know what, I wanted to get resources, purchase medical equipment, partner with healthcare providers, go to rural communities, educate them about, you know what, this is hypertension. There are various ways you can modify your life choices to at least if you don't have it, prevent it. If you have it, manage it. And also we went there with our medical equipment to screen everyone to ensure that they are not hypertensive. And if they are hypertensive, how can we support them? So that is how I started in 2017 with the goal of bringing health education and early screenings to the communities that I grew up in and similar communities like that. And so 2017, when I went back to Ghana to do this health screening, it was very successful. And there was one story that came out where there was this woman who was very reluctant to come to the screening. So I mean, when we go to Ghana and do these screenings, we partner with various healthcare providers and then have a place where everyone comes there and then we do that. But we realized that this woman was reluctant to come, and we were just out of curiosity. So we called one of the doctors. The doctor spoke with the woman, and eventually she came. And guess what? When we checked her blood pressure, it was over 200.
Oh
And
my
so at that
gosh.
point, the doctor was like, you know what? Let's stop whatever we are doing. We need to rush this person to the emergency right now because they don't know what is going to happen the next minute or the next hour.
Yeah.
And so we did that. We went to the hospital. The attending physician was like, I mean, he was even amazed. It was like, how is this person leaving, right, with this high blood pressure numbers? And so it was an emergency case. I mean, they had to stabilize this woman. And right now, the woman is still alive, right? And
Wow.
so I was sitting there and I was reflecting. I was like, you know, this small action of me going back, doing education and screening people was able to save a life, right? And so that was where I doubled down to do this every year. So I was in college. I was in third year, so my junior year. So every vacation, every summer, winter, I go back to Ghana. I mean, to do it into rural communities to do the health screening and educate people. And sometimes it's very difficult to get funding. So I used to work as a librarian in school. So whatever small funds that I'll get, then I'll use that to purchase these supplies and go to these communities to provide care. So I was doing this every single year. And I mean, doing this also gave me the opportunity to now build a relationship with these community members to really identify the reason why they are not going to the hospital. I mean, we realized that, well, I mean, first of all, the distance to the healthcare center was a barrier. The finances to pay for healthcare was another barrier. But we wanted to know if there was anything other than these two that prevents people from going to the hospital. And that was when we realized that, these people are in the semi-informal market. So Ghana, we have a very huge semi-informal market, which means a lot of people, I mean, get money from what they sell in the market, right? So
Yeah.
if I have a box of tomatoes, I sell that in the market, that determines the money I get for the day. So I'm not guaranteed of a monthly income,
Right.
but based on what I sell. So we are dealing with people who are like breadwinners who have to sell to get money,
Yeah.
to serve their family. So to tell this person that leave your farm, leave the market, go to the hospital where there's no guarantee that you're going to see a doctor and stay there for hours means that the person would have to forgo all this. I mean, the money, and if the person is a breadwinner, that is a very big ask from the person. And so we were interacting with people who have to constantly debate whether I choose to sell them in the market, get money to serve my family, or I go to the hospital, which even I'm not even sure that I'll get to see a doctor. And for the most part, people would take the first one where they have to support their family.
Yeah.
And the only reason they will go to the hospital is when they have no option. It's like, I'm sick, I can't go to the market. This is like, I either have to go to the hospital or I will die. So that is, I mean, the situation that people were living. And I was like, you know what? I mean, how can we create a system, or how can we create a solution where we would bring the healthcare to the people? They don't have to come or walk several distances. We would bring the healthcare to them in their community and then serve them there. And that was the birth of our Hope Health Van, our mobile health van, where we've designed the van like a doctor's clinic.
Mhm.
We do lab diagnostics. So we have point of care diagnostics. We do about 9 of them, like for malaria, for HB, for hepatitis B and C, for H. pylori, for ulcer, for all the STIs, the gonorrhea, syphilis, urine tract infection. So we do all these point of care lab diagnostics in the van. We go there with seasoned healthcare providers like physicians, nurses, lab technicians, pharmacists. We carry medication in the van and we go to these rural communities and then we provide them with healthcare. So they take about 5 to 10 minutes of their time, come and see a doctor, get all their needed medical needs and then go back to the farm. And so that is the bed of the mobile health van, where we have this van and we go to rural communities and provide them with healthcare, primary and preventative healthcare. But apart from what we do with the mobile health van, we also realized that mental health was a very big issue in Ghana. So currently in the country, we have only 3 psychiatric hospitals, and we have only 74 psychiatrists in the country, serving
Wow.
32 million people in the country. So that shows the gap when it comes to mental health accessibility and provision of care. And so what we started last year was that we are going to educate the youth, and was the goal that once we educate the youth, they are going to go home, share the information with their family, share the information with their loved ones. And that way we are able to push out mental health education, because right now in Ghana, if anyone show any symptoms of mental health, they are considered as a weak person. So no one wants to show that they are going through this. It's like everyone is going to keep it to themselves until they have no other choice but to either commit a suicide or do something worse. And so with our mental health initiative, we've been going to various high schools to provide them with mental health education and also mental health resources. We've been to about 6 high schools, serving over 3,000 individuals with our mental health education and resources. And also with the mobile health van, we've been to over 66 rural communities, serving 6,000 people across these communities. And so with OKB Hope Foundation, our vision is really to ensure that everyone has access to timely and quality healthcare, irrespective of their socio-economic background. And this is what we've been up to since 2017. Yeah.
So not much. You haven't been doing. You haven't been doing much. No. Oh my gosh. Wow. So much. Well, first of all, let me just go back and say I'm so sorry for the losses that you experienced. Unnecessary loss of life is just always the most tragic. And I'm so sorry you went through that. But I love that you turned that into a mission, and as so many people that I interview on here or work with in the nonprofit sector, are driven by something they experienced. But man, you really took this one and ran with it. So the OKB Hope Foundation, I'm assuming OKB is your initials, yes?
Yeah, that's my initials. Yeah.
So the OKB Hope Foundation is now providing healthcare screening and services to over 5,000 people in 52 rural communities across Ghana. Yes, that's
yeah.
And you've been only doing this for 7 years.
Yeah, for 7 years. So, we started as a project in 2017. And so the foundation was registered in Ghana in 2018 and registered in the US in 2020. So I would say about, 6 years we've been doing this.
And with a pandemic in the middle.
And the pandemic in the middle, yeah.
Sure. So no big deal. This is super impressive. What have been some of the biggest hurdles that you've had to overcome I would imagine infrastructure has got to be just a huge one, funding, all that. But what was the journey like? What were the things that you really you had to face?
Yeah, I know. I realize that you've mentioned a couple. One was funding. Starting this off, funding was a huge thing. So for me, I started that from my own sort of personal contribution to it. So I remember when I was working with Henry Ford Health, most of my salary was going into this. So like about 80 to 90%, I get the funds and then it goes to that. And so funding was really difficult to come by to really make it happen. But I was really committed to ensuring that this happened. So I didn't mind doing or making all these sacrifices. But on the ground too, there were a lot of hurdles, because right now in Ghana, there wasn't any sort of policy around mobile healthcare, right?
Okay.
And so it was very difficult to penetrate into that, and so we had to do other things like they required of us to have a facility so that they can come and inspect that. So all these things were some of the barriers that we faced when we wanted to operate this mobile healthcare in Ghana, but we had to do all those to ensure that we are able to do the provide the services. Other operational ones has been in these rural communities, the roads are not that great, right? So it has a lot of potholes. When it rains, it's very difficult to get into the communities. There has been instances where our van has gotten stuck in mud, and then all the healthcare providers, we had to push the van through the mud. All these are some fun challenges. We consider that as fun. It's a new adventure where the van, it has gone through its own maintenance and repairs because of the way we were using it. Typically, we can go a whole week just go into communities throughout the week, so like the van is a machine, so sometimes it gives up and then we have to fix it and then do that again. And some of these challenges has also been with the community members as well, right? So some of them, a little background is that the northern part of Ghana is not that developed compared to the southern part of Ghana, right? So individuals would migrate from the northern part and come to the south. And once they come, there is that language barrier that happens, right? Because in Ghana, we speak a lot of languages. Like, for example, if I'm from the southern part of Ghana, right? If I go to the northern part of Ghana, it's pretty much a totally different country because I don't understand whatever they are talking about, right? That is how it is. And so when these people migrate to the southern parts, one of the reasons why they don't seek healthcare is the language barrier, right? Because no one understands what they are saying. And so these are some of the challenges that we face when we go to communities where most of them are from the northern part of Ghana, right? You have to have like someone who speaks their language and also speaks the language of the South to be able to provide healthcare. And one of the challenges that we face has been, we still call it maybe gender inequality, power dynamics, where women or females still have to get permission from their husband before they can come and seek healthcare, right? So
that makes sense.
We go to communities like that. It's like, we can't do anything unless my husband agrees to it, right? Before I can come and do that. And so these are some challenges that we face that has given us a lot of ideas to work through, because we realize that every challenge was unique, and so the solution needs to be unique and tailored to each community that we serve. Yeah.
Wow. Yeah, it's so interesting. This is obviously a podcast that is for people in the nonprofit sector, people doing good in the world. And while the challenges are unique from organization to organization, person to person, it's still these barriers that everyone is having to figure out how to tackle in their own ways, and whether it's in a neighborhood down the street from me or it's in Ghana. How hard has it been? I mean, you ended up being on the top 10 CNN heroes of 2023, which, congratulations, that's pretty cool, right? How did that happen, first of all? And then just how has the journey been on this side, bringing awareness to this and raising funds and all of that? It seems like you've some success in that. How'd you get that?
Yeah. So the story was a very interesting one. So I clearly remember this. I think it was in March. It was a Wednesday morning, and I had a call. It was a 973 from New York, and so I was like, okay, I don't know anyone, but let me pick and see whether it's a spam or a scam call.
Yeah.
And I picked, and the person was like, yeah, I'm calling from CNN. And at that moment, I was like, CNN, why? What's going on? I stopped for a bit and I was like, what's going on? And it's like, yeah, we got your nomination and we are interested in learning more about your work. It's very impressive. And I was like, okay, sure, I'm happy to share what I'm doing. And so that is how it started. Apparently, I got nominated for the work that I was doing. And then I got to know this once I was on the other side of it. When I was speaking with them, it's like they get thousands of nominations,
Yeah.
and then they have to screen through those and select the top 20,
Okay.
and then sort of do their due diligence. So it's a very long process. And so I was really humbled, and I really thank God for their opportunity, because it was really unexpected. I wasn't
Yeah.
doing that. And it came at a time where I had decided that it came at a time where I had quit my job, where I was like, you know what, I'm going to go into this full time. And so it came at the right time. I would
Mhm.
say that the timing was right, because I was like, you know what, yeah, I'm doing great with my job. I'm really passionate about doing this. So I wanted to, focus on that with no sort of plan in mind. I was like, I'm just gonna take this step and do this. And so when I got the call, they asked me about the work that I was doing. They did their due diligence, called people in Ghana, called people in the US to really figure out whether what I was doing was, really credible.
Sure.
And then in the summer, in June, they came to Ghana to document the work that we are doing. And then in August, they published the story. And so, that brought a lot of eyes on the work that we are doing,
Oh
because
yeah.
I said that even in Ghana, we didn't even get any press around that until CNN came through. We've been doing this work for years, and we
Yeah.
didn't get any press around what we are doing unless until CNN came in and like published the story, and then we got all this attention from the media that want to know more about what we are doing. And so I would say that since our story came, our CNN published the story, and even being part of the top 10 CNN heroes has brought a lot of attention to the work that we are doing. And I always say to myself that is a very difficult job for CNN, because all their people are doing amazing work. To
Yeah.
be able to really identify the top 10 it's really a difficult job to do. But because of that, we've been able, through the CNN Heroes, CNN organized a fundraiser for us.
Oh wow.
So we're able to raise money through that GoFundMe to support the work that we are doing. There is this amazing foundation, Elevate Prize Foundation, also gave us a grant to continue with the work that we are doing. And so through that, we've been able to secure some resources, which means that it has allowed us to, really expand the work that we are doing. Currently, we are in the process of getting a second van. We are also trying to get medical equipment that would be able to help us to properly diagnose people and not misdiagnose people. So it has really helped us with the operations of the work that we're doing. And there's also added credibility to the work that we are doing. So now people
Of course.
really know that we are doing a very impactful, legit work in Ghana. And, our really, we got a lot of calls from other, sub-Saharan people from other sub-Saharan African countries saying that, you know what, this could work in our country. How can we
Yeah.
bring it there? Like, how can we duplicate that? And so we are still trying to really get resources and not only expand in Ghana, but expand, beyond the borders
Yeah.
of Ghana to bring healthcare to individuals in the rural community. So I would say that this exposure from CNN really, really, helped us to really, get attention on the work that we are doing, and also the resources and the support to expand the work that we are doing as well.
That's amazing. What a great story. And I've been taught in what I do, I talk a lot about storytelling and how stories are, for nonprofits in particular, but for everybody, but so much for nonprofits, are really our best tool for bringing people into what we're doing, because most people can't go there and see it and experience it. Obviously, that would be the most ideal if everybody could go and see it and go, "Oh, this is amazing. I want to help." But it's how do we bring people into the story? And obviously you've got a great one, and also you tell it well, and you've had opportunities to amplify that, and the more we can do that, it's just the amount of negative energy in the world and stories and things coming out all the time, it's so encouraging to hear stories like this. And I think it's not it's in some ways, because the world is so negative, we can mobilize people a little bit more because they're looking for the positive is so rare, and when they hear it, then
Yeah.
it's exciting to hear and get swept up in. So, man, what a great story. Let me ask you just a few closing questions here. This has gone by so quickly. We could talk about this all day, but what role for you does community play in your work, in doing this work?
Yeah, so for me, I would say community is everything for us to even get the opportunity to do what we are doing. It takes a community to do that, and that could be a community of healthcare providers, community of key stakeholders, and the community members themselves. And I always say that, I mean, for me, I'm just a vessel that is being used, and I know that I cannot do everything alone. And so it takes a whole community to do this. I'm not a healthcare provider,
Yeah.
and I cannot deliver the care. So I need a community of healthcare providers to really push this, I mean, for me. And so for me, I would say that community is everything. For example, getting to these community members, there are certain key holders that stakeholders that you have to work with. Every community have people that they trust, right? And so even though I have resources, I have healthcare providers, I can't go to any rural community and hope that the people will come to me. I have to work through the people that they trust,
Yeah.
right?
Yeah.
And in any community is different. One community will be their religious leader. In another community will be their community leader, or sometimes they call them opinion leaders.
Yeah.
In another community will be the chief. So every community has their own people that they trust. And to get to serve these people, you need to work with these key stakeholders to get to that point. And so for us, that has been, we are community people, we are grassroots people. So we work with these community stakeholders, and they would now tell us, you know what, for my community, this is when they are home, because each community has days that they go to the farm, days that they go to the market. So they will let us know this is the day that the community members are free. This is the time that you guys can come. And that is how we are able to operate. And so for us, community has been everything. I always say that the work that we do as nonprofit leaders is all based on community, being able to sell the vision to get the community to support. Because as a nonprofit leader, you cannot do everything by yourself.
No.
And you need people to support the vision for you to be able to make the impact that you want to make. So, I mean, for me, community play a very key role, and has been, community play a very key role, and that has been the one that has made whatever we've done become a success. Because without the community, I don't know how we'll be able to do that.
Yeah. All right. Last question. What in your job brings you the most joy?
For me, is going to a community where they don't have any healthcare facility, and after providing the care, the people come back to you, even though they don't have money, bring something in kind. That could be a box of tomatoes or plantain, just to show the gratitude. And so, I mean, that alone speaks volumes for the people, of the attitude of gratitude.
Yeah.
But it also makes me think that, you know what could have happened if the van wasn't there for these people. And so that is the thing that keeps me going. And that's the thing that I always think about, like, you know what, every time that I delay in bringing my mobile health van to this particular community, someone else pays with their life. There's someone who is losing their life because my van is not there. And that is something that keeps me up at night, and like, how do I get to these people? And that is what, I mean, keeps me going and makes me fulfilled if I'm able to go there with the van and at least save a life with the van.
That's amazing. You're an amazing guy. I'm so thankful that you are doing what you're doing and that you were willing to come on the podcast and share that with us. It's very impressive. This is very it's encouraging, and man, what a great example too you're setting for youth and the people that you're serving, and it's fantastic. If people want to know more about OKB Hope Foundation, where can they find that? Where can they connect with you?
Yeah, so they can go on our website www.okbfoundation.org. We are on all the social media channels. So on LinkedIn, OKB Hope Foundation, on Instagram, OKB Hope Foundation, on Facebook, OKB Hope Foundation, on X, OKB Hope Foundation, and also on TikTok, OKB Hope Foundation. And that is where we post most of our updates on our social media channels. Individuals can also subscribe to our newsletter on our website as well to get our monthly updates and also quarterly updates from the work that we've been doing here in Ghana.
Well, thank you so much for doing this. And I hope, man, I can't wait to actually hear about what you do next and how it grows. Because I think if you can do this in the first 7 or 8 years, who knows what you'll be doing 10 years from now. You'll be taking over the world.
Thank you so much for giving me this opportunity. I mean, to share our story. And as you mentioned, story is one of the ways that we are able to share the work that we do as nonprofit leaders. So platforms like this help us to really amplify our story. So thank you so much, for giving me this opportunity to do this.
Absolutely. Thanks for being here.
Thank you.
Creating Good with Matt Barnes is recorded at Rogue Collective in beautiful Newport Beach, California. It's hosted and executive produced by me, Matt Barnes, with an assist by my chaos coordinator, Tiffany Pope. Production is by our amazing friends over at Fame, the B2B podcast agency, along with Belinda Carter-Thompson and the team here at Rogue Creatives. Production lead is Mike Love at Fame. Writing is by Will Ainsley at Fame and Matt Barnes and Taylor Bolanos of Rogue Creatives. Miguel Mendoza of Fame is our audio editor, and Arslan Yacoub from Fame is our video editor. Creative direction and design is overseen by Corey Hill of Rogue Creatives. Our artwork is designed by the Rogue Creatives team and Rufino Mejia of Fame. Theme music is composed and performed by Jared Atherton of Chapters. Marcus Ponta and Mike Love of Fame do our booking and guest relations. Huge thanks to our amazing guests for joining us for this episode, and thank you to all of you incredible listeners for tuning in. If you enjoyed the show, and if you're still listening at this point, I'm assuming you did, don't forget to help us spread some good by giving us a good or great review. Preferably the 5 stars kind with really nice words, telling us how much you loved it, telling everybody else how much you loved it. Also, tell your friends and subscribe so we can come straight into your potholes each and every time we have a new episode. For more information about Creating Good or to join us at a live event in Orange County, California, visit our website at creatinggood.co. We'll catch you next time. This has been a Rogue Creatives production.